Good afternoon. I'm Maria Tilden, and I am the Executive Vice President for Marketing, Communications, and External Affairs with CareFirst Blue Cross Blue Shield. I cannot tell you how excited I am to be here today with some really special people to announce an incredibly important investment in moms and babies for the region. For those of you who are not aware, CareFirst Blue Cross Blue Shield is a health insurance company. We also like to call ourselves a health care company because we are focused on ensuring that not only are we providing great benefits and services to our members, but as a not-for-profit entity, we are investing in those issues in the community that ensure broader access and affordability to health care. Since 2007, CareFirst Blue Cross Blue Shield has invested over $20 million to support maternal and child health initiatives. That includes today's announcement of $2.15 million in grants to 12 organizations in Washington, D.C., Northern Virginia, and Maryland that will help ensure that every baby has a healthy start. The programs we're highlighting today will impact more than 10,000 individuals who might not otherwise have received the type of care that they need. Our grants will support prenatal care, centering pregnancy, doula services, home visiting, breastfeeding, adoption, birth spacing, and address postpartum depression and substance use. I am thrilled to join Mayor Bowser's efforts here in the District of Columbia and other regional elected officials and health departments to make a meaningful impact to address disparities and improve maternal and child health outcomes. It is my pleasure and honor to be the person that gets to introduce someone that I have known for over 10 years, it seems, since she was an extraordinary member and chair of her committee on the council. Through her leadership as mayor, Mayor Bowser has been focused on ensuring access and affordability, breaking down barriers, and eliminating disparities here in the district. I'm particularly honored to be a member of the mayor's healthcare commission. The mayor's commission on healthcare transformation, another demonstration of her commitment and focus on ensuring that everyone in the district has access to affordable and accessible care. And without further ado, Mayor Muriel Bowser.
Well, good afternoon, everybody. I am very delighted to be here, and it was nice to sit in the audience. Usually when I'm in this room, I'm always looking this way towards you, and to look back and see our portrait of Frederick Douglass in our ceremonial room in this beautiful building that we get to come to work in every day is just a reminder of the awesome responsibility we have inherited as Washingtonians to make sure that all of the progress and prosperity that we are growing in this city is achievable for everyone. And because of the progress and prosperity that we have an incredible ability to be able to invest in the people of Washington, D.C. And I know everybody in this room believes this, that you should be able to have a baby in this country, in this city, without risking your life. And we have a lot of work to do to make sure that is a reality for every woman who's having a baby and for every infant born in our city. I am delighted to stand with CareFirst as it makes a regional investment of $2.1 million in maternal and child health. I am also very proud that it lines up with very important initiatives in our administration. I do want to acknowledge two women who helped lead this work across all the agencies of D.C. government. Faith Gibson Hubbard, who I appointed this year to lead our Thrive by 5 work in D.C. government, and Jennifer Porter, who leads my office on women's policy and initiatives, who's in the back just there. Many people would have probably met them in one of our 2 national women's maternal and infant health symposiums that we held here in Washington, D.C., where each time over 1,000 people gathered to hear from national experts, political officials, and others to talk about what we need to do as a nation, what we need to do as provider communities, elected officials, hospital systems, to make sure that we are putting ourselves on track to have healthier moms and babies. And that is the work that we have pledged to do, not only in an annual gathering, but in making sure that we are investing in our Department of Health's plan to get us there. We know, and we have learned even more in our gatherings to focus on this critical issue, that so much is being done in the grassroots, and that is how we know that we will continue to invest. We learn that moms are going to go to trusted organizations, and that's not always a traditional provider. And we know that we have to figure out how to raise up those experiences to more people. That's why I am delighted that Mama Totu Village, Mary Center, MedStar Washington, and the Community of Hope are being recognized today for their great work in the community. This is an issue where I know many of us think, why don't we know more? Why hasn't the research and the studies shown how we can have better health outcomes for moms and babies in a nation like ours? And how we are going to turn those numbers around will take all of us demanding that the dollars go where they need to be, that the research happens the way it should, and that we execute on all levels. But it's also important to know that the decisions in the outcomes for moms and babies don't start with pregnancy. They start with moms being healthy to begin with. And it takes a lot. Claps the nurse. I was raised by a nurse, so I know a thing or two about nurses. But we know to support families, it starts with access to great care, access to primary services, specialty services, good food, safe housing, great schools. All of those things will help us have more healthy moms and more healthy babies. So we're delighted to be here. I'm looking forward to hearing about all of the things that you all are doing and all of the ways that you're going to challenge us to do more. Congratulations.
Thanks again, Mayor Bowser, for your leadership, your commitment, your energy around ensuring that every mom and baby has access to care and all of the other social supports that are necessary in order to live a thriving life. And thanks also to your incredible leadership. Part of the process that we went through as an organization was to actually sit down with leadership in each of the jurisdictions to better understand where the gaps were and what kinds of investments we needed to make. And we are delighted to have the opportunity to be in partnership with not only your administration, but leadership from all over the region. Speaking of which, it's my honor and pleasure to introduce you to Dr. Ernest Carter, who I guess I might be the first person publicly to announce, was just sworn in as the new health officer for the Prince George's County.
Thank you so much, Maria. I'd like to thank you all for inviting us here. Thank you, Mayor. I think those were inspiring words, and for Prince George's County, it means a lot to be in this particular union with these various regions sponsored by CareFirst. That's important to us because our women don't respect the borders. They go from, sometimes they call us Ward 9. We don't like it, but they'll go back and forth. Sometimes they go into Virginia. So, no, and that's really important to us that we have a coordinated effort for our women. And we've been looking particularly at women who are at high risk. And in our administrative care coordination unit, we're tracking down women who really need the care. And so this particular grant is the spark for us to help us with our population health approach to helping women who have significant risk, to get them into care, figure out how to get them into care early, help them when they're pregnant, figure out what we have to do when they're postpartum, by making sure we take care of their social determinants, their medication therapy management, their behavioral health. And so we're using a community health worker model, but it is in a population health model. And I have Deborah Magruder here, who is my division manager over health and wellness and who's over this project. And I have Shirley Schiffler, I can always say your name wrong, I'm sorry, who is our project manager. And they hear this from me all the time. But our goal here is to make sure that if we can understand how women who are at highest risk, if we can develop a model around that and understand that continuum, then we're going to be able to expand that and scale it up. And this is what CareFirst did for us. They gave us that those spark dollars, because this is hard to get dollars in Prince George's County. I don't know, I guess, D.C. has all this cash, but us, we don't have cash. So we have to scramble. I'm sorry. No, but we have to scramble, and when we get these dollars, we have to be very targeted, because in Prince George's County, whether you all know this or not, it's just very small areas. If you look in just one zip code, within that zip code there are significant hot spots where some people are doing extremely well, other people are not doing so well. So we have to be strategic, and that's why I just wanted to thank CareFirst for this, and it's very helpful for us, and you won't be disappointed. We will work very hard to make this successful. Thank you.
Thank you, Dr. Carter. I suspect that Mayor Bowser would beg to disagree. Speaking of Mayor Bowser in the District of Columbia, another dear partner and friend is here to represent Community of Hope. Kelly McSwain is the president and CEO of Community of Hope. CareFirst is contributing $250,000 to support her organization's effort in prenatal care, home visits, postpartum depression service, and she's just one of the wonderful organizations that are represented here that will benefit from these contributions. And if Kelly, you would come up.
So good afternoon. I'm honored to be here this afternoon, and I just also want to thank Mayor Bowser as a DC-based nonprofit and a proud DC resident. Really grateful for your leadership and your personal commitment, including the Maternal Health Summit and Maternal Mondays, which were my favorite as well, to get a lot of social media out there about the work. So in terms of as Community of Hope and on behalf of all the nonprofits here, I really want to thank CareFirst and all of our friends and board members for your support of Community of Hope. I really credit CareFirst for really seeding what is becoming a very robust set of maternal and child health services at Community of Hope and throughout east of the river in particular. So Community of Hope has a big mission. Our mission includes working to end homelessness for families in the District of Columbia, as well as working to improve health in order to create more equity within the city. We have 3 different health centers throughout the city, where we provide medical care, dental care, and emotional wellness services, and a wide range of supportive services. But we opened our Ward 8 site about 5.5 years ago, and again, an original grant from CareFirst talking about sparking, really allowing us to go out to do outreach, identify women who are pregnant, and have them come in and provide a wide range of services, including evidence-based centering pregnancy. And we will use the funds this year to continue to expand that work. We also have a midwifery model where midwives provide and support prenatal care both at Washington Hospital Center MedStar as well as Family Health and Birth Center. And then we've also, through DC Health and other support from foundations, really expanded to home visiting. So again, the idea is wrapping women and their children with love throughout that entire experience to really support them. We know that the challenges related to maternal and child health will not be solved easily, nor will they be solved by one organization alone. So it will really take a unified and collaborative approach. So on behalf of all the nonprofits, really thank CareFirst, and that you've not only given funds, but also have really convened spaces for us to talk about this as a regional issue. As Dr. Carter said, women are crossing across borders, and the social determinants and challenges are faced wherever women live, and it's really important to live together. I especially want to congratulate our fellow grantees from DC, Northern Virginia, and Maryland, friends and partners, and that we will continue to work together. And I do believe that as a region, we can make progress in addressing disparities in maternal and child health and improving birth outcomes. And we're pleased to be part of this effort and really look forward to continued partnership. Thank you.
Thanks so much, Kelly. And none of this would be possible if it weren't for CareFirst Board. So as I mentioned, CareFirst is a not-for-profit entity, and we are literally dedicated to ensuring access and affordability to care across the region, throughout the community. And we have here today, and I don't see them, but yes, I do. Henry Green in the back, a member of our Mission Oversight Committee. Jalissa Marenko was here, but I think she may have escaped. Also a member of our Mission Oversight Committee, and Shirley Marcus Allen, another member of our Mission Oversight Committee. We take our investments in the community very seriously, so seriously. We actually have a board committee that is responsible for oversight and strategy of how we invest in the community, and they immediately recognize that the urgent need for us to focus on maternal and child health, and to them, I am grateful for their leadership and support, and wanted to be sure to acknowledge them. So at this moment, the most important time, I'd love to invite all of the recipients of the awards up to the podium, and I just want to be clear and share the names of the grantees with each and every one of you. And as I mentioned your name, if you would come up, that would be great. So CCI Health and Wellness, Kathy Nohoff, who is the president and CEO of that organization located in Prince George's County and Montgomery County. Community of Hope, Kelly McShane. Mama Toto Village, Aza Nedhari, also a DC-based organization. Mary Center, Maria Gomez. MedStar Washington Hospital Center, Beverly Lyles. Beverly. Neighborhood Health, Nirma Hernandez. I have not yet seen her. Neighborhood Health is an organization based in Northern Virginia. Northern Virginia Family Services, Sarah Kreitzer. Pregnancy Aid Center from Prince George's County, Mary Jalasik. And of course, Prince George's County Health Department, Dr. Carter. And we wouldn't be able to do this without Mayor Bowser, of course.
Right here, middle camera.